So I'm with a company called Interopion, and the mission of Interopion is to empower healthcare delivery through interoperable EHR integrated solutions. So our company has been built grounds up to support the enterprise and healthcare systems that would like to leverage Smart on FHIR and CDS hooks technologies. So we have quite a range of clients, from healthcare systems to payers, such as United Healthcare and large pharma companies. Throughout the years, and we were one of the first companies to embrace the Smart on FHIR and FHIR and CDS hooks technologies. We developed some of the first Smart on FHIR applications. You might have seen some of our applications in our portfolio. They have been pretty widely used and also featured in HIMSS and other forums. So today, I would like to show you our newest application. So the Interopion Pediatric Suite, which is a must-have comprehensive toolkit for the modern pediatric practice. So it's a number of best-of-breed pediatric tools, which have been very conveniently packaged in a modern design under one single application. So the suite includes tools such as bilirubin risk charts, our specific risk chart for near-term and preterm infants, BP centiles, blood pressure percentile calculation for diagnosis of hypertension, growth charts, interactive growth charts for growth analysis, and also intake forms, which is our application which enables automated collection of data based on the standardized forms of American Academy of Pediatrics. While the patient is waiting in the room or at home, there are multiple ways to use the application. So, well, enough of that talking. Let's bring out the beast and see what happens. Okay. All right. I apologize, just 1 second. Okay. So, I wanted to show you very quickly the application. Okay, there we go. So I'm actually going to launch the application through Interopion, which is our interoperability platform for leveraging the Smart on FHIR and FHIR technologies, and which integrates with popular EHR systems. It's sort of equivalent to Vonk and 8box, etc. So it's a fairly powerful system. So let's see here. So here I have Pediatric Suite set up, and I have configured it against one of my data gateways, and I'm going to launch it. Okay. All right. Oop. I'm going to pick up one of my sample patients that I know of has a good range of data for the purposes of our demo. And here we go. This is the Pediatric Suite. So I'll give you a quick walkthrough of the modules of the suite. So we have the growth charts application. That's version 2, and shortly after we'll follow up with version 3 of the module. So it follows up on the free growth charts application, which unfortunately is no longer supported and somewhat out of date. So it's an interactive growth chart which enables the pediatrician to plot the data over popular growth charts, and it's an extensible list where you can load your own growth charts and overlay multiple of those. For example, here besides CDC, I'm going to overlay a growth chart for children with Down syndrome, just to see how the data might look on that chart. And you can zoom in and out of different places of the chart, and there are various ways to interact with the chart on touch devices and with mouse pointer, etc. There's a table view to export data further. It's customizable in a whole lot of ways, and we can also easily generate a printout of the chart as well. So next, we'll show you blood pressure percentiles. Most of the cases of hypertension in children get undiagnosed because of the complexity of calculating, normalizing the blood pressure, in essence, by factoring in gender, height, age, and normalizing the blood pressure for children. But our blood pressure percentiles tool makes that extremely simple and does all the hard lifting work for you and plots the data right on screen in a format which is easy to explore and to notice data that might be problematic. And also you can drill down in the data in various formats. Also, it's available in a classical table view for those who'd like to get a little bit more closer look at the data. The module also comes with a what-if scenario calculator, where the physician might do a little bit of what-if and see what happens if the blood pressure goes into, for example, a certain range. What about a couple months from now, maybe a year and something, raise the height a little bit, etc. So what-if scenarios. The bilirubin risk chart module plots bilirubin data for near-term infants. Elevated levels of bilirubin in a newborn shortly after birth for prolonged periods of time could lead to brain damage. So bringing down the bilirubin is quite critical whenever there is an issue with the levels of bilirubin. So the application automatically calculates and plots the total serum bilirubin, transcutaneous bilirubin data that is available from FHIR. Also shows phototherapy. There are trend lines which will appear in certain instances. You can look at the risk factors for children, also look at the guideline, based on the data that we have. What does the guideline say? And right from inside the application, you can edit the data at your own new data points if available. And it also has a patient-friendly view, or rather parents-friendly view, where we might be able to have a meaningful conversation with the parents around a slightly simplified view of the data. And we can also send them home with a printout by clicking on the print button and generating a nice printout for them. So finally, I'd like to show you the intake forms application. Okay, so in the intake forms application, what happens first, there is a patient visit. This application could also be launched outside of patient context. If it's launched outside of any patient context, we'll actually be managing a population of patients and be able to track how our patients are doing with filling their form assignments, assign some forms for them. So it also contains this functionality. But right now I'm launching it with a singular patient. So for this patient, we can enter the email address, we can provide some additional data. The application already suggests some forms which might be relevant to the patient based on demographic and other factors. And we can choose some other forms as well. Okay. And then what happens is now the forms are assigned to the patient. The patient is going to get also a nice email which looks something like, not like that, like that. Okay, so the patient is going to have this QR code and access code and a link to follow. They'll need to enter their last name, date of birth, social security number, whatever, to authenticate, and then they can fill the form right at home or on a mobile device by snapping in the QR code. So multiple ways of doing that, or while they're waiting in the waiting room. So I'm going to pick up one of these questionnaires. There are multiple ways we can fill it. One way is going one by one through the questions, just like that. And as I'm clicking, we automatically advance through the questionnaire. Or we can choose a more traditional format where the user might need to scroll up and down, or on touch device, drag the form around, and we can periodically save, or once the form is completed, then the data will automatically be sent and submitted to the provider. Okay, so this is the walkthrough of the pediatric suite. We are constantly upgrading the modules of the suite, and we are planning on adding some new modules available to the pediatrician. Pediatrics has been traditionally underserved by EHR vendors as kind of a niche specialty, and we do believe that pediatrics deserves the best tools to efficiently address the needs of our children. Okay, and that's my whole demonstration. So thank you very much, and I think voting is next.